third question is about fear and anxiety,
Yeah,
which can be overwhelming,
yeah.
or rather, which are overwhelming. So, how can men recognize and effectively cope with these emotions in their daily lives, and what strategies or tools can they use to manage and reduce anxiety?
Right. Okay, so that's a great question because there's a lot of misunderstanding about fear, anxiety, depression, stress. So sometimes if you often feel anxious or depressed for no apparent reason, uh, but you may have an anxiety disorder or depression or both. It's not unusual for someone to suffer from both conditions in the same time. So they are serious, but at the same time, with medication or cognitive behavioral therapy, because the both depression and anxiety share similar symptoms like nervousness or irritability or insomnia, problems with concentrating. Then when it comes to anxiety, so you may experience fear or panic, or a constant nagging worry or anxiousness. Then panic attacks or anxiety attacks, right? Then when people are depressed, it affects just about everything in your life: how you think, how you feel, behave, or how you function. And you also may experience one or more symptoms like discouragement or sadness or hopelessness or anger, lack of motivation, low energy level, feeling overwhelmed in by doing daily tasks or personal interactions. So if those feelings or last longer than 2 weeks, and interfere with your daily activities like spending time with your family, your friends, caring for your family, or going to work. So mostly, it looks like you're experiencing a major depressive episode, right? Then stress and anxiety may seem similar, but they are not the same, because the stress is a response to our daily pressures or a threatening situation, while anxiety is a reaction to the stress. So anxiety, which has no clear cause, tends to last longer and be a little more difficult to treat. But stress affects a lot of people, can influence your health, like headaches, high blood pressure, chest pain, heart palpitations, skin rashes, loss of sleep, right? So I think it's important to understand how it's affecting a person. Anxiety is more having, like, it's not about sweaty palms. It's like butterflies in your stomach, or symptoms of anxiety can include ongoing feelings of worry or a fear or impending doom that's so severe at which may interfere with your ability to work, as I said before. Then tune into your body, right? So what are some of the physical symptoms of your anxiety? Is it like about pounding your heart, or muscle tensions, or dizziness, or vertigo, insomnia, panic attacks, shortness of breath, right? Then also tune into your emotional signals, like frequent worry, concentration problems or avoidance, catastrophic thinking, lifestyle changes, so anything, right? So some of the strategies people can try is lifestyle changes, such as spending time with supportive friends and family, as I said before, regular exercise, getting enough sleep, maintain a healthy diet, and cutting down on alcohol or any other substances, and psychological treatments, including cognitive behavioral therapy. So they all are effective treatment, treatment in anxiety or depression, and are often, recommended first, particularly for mild to moderate anxiety and depression. Um, Sometimes the family doctor, so if you go to a family doctor, they can refer you to a psychologist or counselor or social work for this kind of treatment. For some people, antidepressant medication might also be an option. So there are a lot of things you can do to look after your health and well-being. So find the best approach suitable for you. For example, try to stay active and make plans for the day. They don't have to be big plans, just small things that you can do, which should be realistic and attainable. Then try to find or include activities or hobbies that you specifically enjoy, maybe gardening, or maybe playing badminton, or playing cricket, or whatever you enjoy, right? So it's also important to look after your body by staying physically active, eating healthy and getting plenty of sleep. Then depression is, or depression or anxiety or worry, let them for example, if you are noticing depressive symptoms or anxiety, or with a friend, let them know that if you are noticing a change in their behavior, or spending time and talking about their experiences, and let them know that you are there to listen without being judgmental. Or help them to get information from a website, or other community resources, or suggest they go to a doctor or health professional, counselor, or a social worker, psychologist, to get to help them make an appointment, or offer to go with them to that appointments. Encourage them to go and like enough sleep or exercise and eat well. Then if a person is struggling a lot with any suicidal ideation or something like that, encourage the family or friends to invite them, and keep in touch, or make a safety plan with that person, right? It is very unhelpful. At the same note, it is very unhelpful to put pressure on them by telling that, okay, get out of that, snap out of it, put your act together. Don't say that ever. Stay away, or it is it's also unhelpful to stay away from them. Tell them they just need to stay busy, or get out more. Assume the problem will just go away, right? So those are some of the things they can try to help a person with mental health challenges.
Does that also include for depression? Because
Yes.
it would be kind of easier to see the signs and symptoms in someone else, or recognize a pattern that something is off
Mhm.
for a few days now. But how do you, I mean, not specifically you, men, recognize it in themselves and actually acknowledge that something's not working right?
Right. Yeah. So, as I said, um, it's a cycle. Depression is when you are when a person is depressed. It affects everything in their life, right? How you think, how they behave, how they function. Some people fail to pay bills, for example. Some people don't have any motivation to go out and do things, or they can't get up and go to work, or they heavily depends on substances, for example, or they lack any motivation, or or interest in general, loss energy level, insomnia, feeling always overwhelmed with everything that they do on a daily basis. And it's important to keep track of everything. So if the symptoms persist for more than 2 weeks, that's the time you contact your doctor and see the doctor. Or if you have employee assistance program, you can contact a counselor through that. Or you can go to book my therapy, for example, and match up with a therapist who can work with you to address your mental health needs.
Well said. Thank you for sharing. So that brings to the end of this podcast. And the last question would be, where can viewers find you online, and what is the best way to reach out to you for booking an appointment?
So there are a few things, a few ways you can find me. My website, www.mngrajesh.ca. Book My Therapy is another source of finding me. Or you can simply contact me by calling 613-406-2563. That's my work number. So you can contact me, or you can reach me at Rajesh at mngrajesh.ca.
Okay, thank you so much. I'll also add all these details in the description box
Please,
for the video.
please, thank you.
Thank you so much, Rajesh, for making the time for this podcast. Really appreciate it.
So, thank you. Thank you so much for inviting me. It's a pleasure.
If you like this episode, please hit the like and subscribe button and let me know in the comment section if you have any feedback or review for us. This will help us reach maximum number of people and create awareness about men's mental health. Thank you. Bye.